All right, guys, let's get right into it. A question I get all the time in my practice is, Dr. Mitchell, is there anything I can do to increase my semen volume? It's a great question, and the answer reveals a lot about your overall health, how your body changes over time, and the simple things you can do to support it naturally. Before we go any further, do me a quick favor. Tap the like button and let me know in the comments where you're tuning in from. And if you want clear, straightforward health advice for men, make sure you subscribe so you never miss an update. The tips I'm sharing today are simple adjustments, but they can lead to noticeable improvements. Here's something that surprises a lot of men. Your semen volume isn't really about sperm count. Sperm makes up only about 5% of the total fluid. The other 95% is a fluid made by several glands. This fluid is what nourishes and transports the sperm. So, while many guys focus on quantity, the health of your glands and the force of your ejaculation are just as important. And that difference between a weak stream and a powerful one. That's less about how much fluid you have and more about the strength of your muscles. I'm Dr. Mitchell. I'm a urologist specializing in men's health, and for over a decade, I've helped men improve their vitality and sexual wellness. I've worked with countless men in their 50s, 60s, and beyond who feel like age has taken a toll on their performance. But I'm here to tell you that's not the end of the story. By building small, consistent, and science-backed habits, you can enhance your semen volume, improve the force of ejaculation, and support your reproductive health. Today, I'm going to guide you through 4 key strategies that really work. I'll break down the how and the why for each one. First, let's talk about smoking. If you smoke, this is the most important one. Biologically, smoking harms the delicate blood vessels and nerves that supply your reproductive system. This can reduce seminal fluid production and even lower your sperm count. Emotionally, a decline in performance can lead to feelings of frustration or embarrassment. When you decide to quit smoking, you're not just healing your body, you're also rebuilding your confidence. Practically start small. Try replacing a smoke break with a short walk or a cup of herbal tea. Every cigarette you skip is a victory for your health and a step towards a stronger ejaculation. Second, drink more water. It's that simple. Biologically, your seminal fluid is made up almost entirely of water. If you're dehydrated, your body simply doesn't have the building blocks it needs. Emotionally, think about how you feel when you're dehydrated. Tired, sluggish, low energy. Good hydration fuels your energy levels and your sexual function. Practically, just check your urine. It should be a light pale yellow. Keep a water bottle with you during the day. Water is your body's internal lubricant. Everything flows better when you're properly hydrated. Third, you need to work on your pelvic floor muscles. Biologically, a key muscle in your pelvic floor is responsible for pushing semen out during orgasm. If this muscle is weak, the expulsion is weaker. If it's strong, the force increases. Emotionally, many men report feeling a greater sense of satisfaction and confidence when their ejaculations are more forceful. Practically, you can do Kegel exercises. To find the right muscles, try to stop the flow of urine midstream. Once you've identified them, contract and hold for 3 to 5 seconds, then release. Aim for 10 to 15 repetitions, a couple of times a day. A quick word of caution. If you deal with chronic pelvic pain or urinary issues, please consult a specialist first. This one muscle is the key to improving your ejaculatory force. Fourth, consider ejaculating less often. Biologically, giving your body more time between ejaculations lets your prostate and seminal vesicles refill completely. Research shows volume can increase significantly for each day of abstinence, leveling off after about 4 days. Emotionally, waiting 2 to 4 days might feel like a test of patience, but the result is often a more powerful and satisfying experience. Practically, try to be mindful of your schedule. This is perhaps the single most effective way to see a quick increase in volume, yet it's the one most guys overlook. Now, It's normal for volume to change based on age, stress, and sleep. Production usually peaks when a man is in his 30s and then slowly declines. That's perfectly natural. However, if you notice a sudden and lasting decrease in volume, it's worth a conversation with your doctor. This could be a sign of something else, like low testosterone, a blockage, or a side effect from certain medications. What about supplements? While no pill will work miracles overnight, certain nutrients can support the glands that produce seminal fluid. Look for ingredients like zinc, selenium, and magnesium. These are all vital for hormone balance and fluid production. Certain herbal extracts like saw palmetto can also support prostate health. Think of supplements as a long-term strategy for supporting your body, not a quick fix. Lifestyle also plays a huge role. Prioritize your sleep, as that's when your body produces testosterone. Stay active with a mix of cardio and weight training to improve blood flow, and manage your stress, because high cortisol levels can negatively impact production. Finally, let's talk about what really matters to your partner. Studies on this are pretty clear. Most women are far more interested in emotional connection and mutual pleasure than in the volume of ejaculate. The takeaway here is to focus on being a present, confident, and attentive partner. That matters more than anything. Here's a simple 4-week plan to get you started. Week 1. Focus on hydration and cutting back on smoking. Notice how your energy levels change. Week 2. Introduce pelvic floor exercises twice a day. You can also add a quality prostate health supplement. Week 3. Start paying attention to your ejaculation frequency. Try aiming for that 2 to 4 day window. Week 4. Bring all these habits together and be consistent. Guys, it's true that semen volume changes with age, but you absolutely have the power to improve the flow, the force, and your overall satisfaction. Small, daily actions truly add up. Remember, age is a factor, but it's not a final verdict. Start today with just one thing. Drink an extra glass of water, do 1 set of Kegels, or just decide to wait an extra day. Build on that success tomorrow. If you found this video useful, please give it a like. And tell me in the comments, which strategy are you going to try first? Subscribe for more no-nonsense men's health advice, and share this with anyone you think could benefit. You can do this. You have the power to make a real difference in your sexual health and confidence.